Welcome everyone. It is a pleasure and honour for me to welcome Dr. David Nabarro, who is the World Health Organization's Special Envoy on COVID-19. I'm Anna Petherick and I'm a Departmental Lecturer at the Blavatnik School of Government. And for this particular conversation, which is a part of a series about government responses to COVID-19, the questions have been supplied by the graduate community at the School of Government. Welcome, David.
Thank you very much, Anna. I'm delighted to be connected with you and with the Blavatnik School. Look forward very much to this discussion.
Great. Well, we've got lots of questions, so I'll jump straight in. So could you explain the process by which the WHO decides what advice to announce to governments and when?
Thank you very much indeed. The World Health Organization is a secretariat that exists to perform functions that are required of it by the World Health Assembly. These are 194 member states that are countries throughout the world. The Assembly sets the rules under which the Secretariat functions. The particular rules for dealing with outbreaks of infectious diseases are contained in the revised international health regulations that were agreed in 2005. These contain the obligations of the member states, i.e. the countries, as well as the duties of the Secretariat. Within the duties of the Secretariat is a role to receive from governments information and then to provide advice back to governments based on that information, as well as based on any scientific evidence that appears, so that altogether the WHO offers advice that reflects its best understanding of the science. The science with regard to COVID has changed a lot because we've only known about this virus since January, and there has been a great deal of work to understand how the virus is transmitted and also the impact that it has on people, as well as the effectiveness of different containment strategies. That does mean that from time to time, the advice provided by the WHO has to change, and that's exactly as it should be. The organization does its best to explain when it's changing its advice, and that is done through regular briefings. In fact, they're provided every day by the WHO Director General and the technical team, and they're disseminated throughout the organization through a well-developed program of information spread. That's why there will be changes. Actually, I think it's right that there are changes because the learning is a continuous process.
Great. So countries have responded very differently. What are the best practices that you have seen in response to the first wave? What would you like to highlight?
Since this virus was first understood, it was clear that it's an unusual virus as a cause of a public health emergency of international concern. In the past, these kinds of serious problems have been as a result of influenza viruses or Ebola. But this is a coronavirus, and we've had major coronavirus outbreaks, one called SARS that occurred in 2003, and another one called MERS that has occurred some years later. And what WHO has said ever since this new coronavirus was discovered is take it seriously. It's not a flu, it's not Ebola. It's full of surprises and it's dangerous. WHO also said that the experience that was being garnered in East Asia that was very much influenced by earlier responses to SARS is very clear. As soon as you get any outbreaks of the disease occurring in any place, it's necessary quickly to suppress them by interrupting transmission as quickly as possible, identifying people with the disease, isolating them, finding their contacts and isolating them, and at the same time protecting people or institutions that are particularly vulnerable to the effect of the virus. Countries that have done best in dealing with their COVID are the countries that have reacted rapidly and robustly to any evidence that there is a case or a series of cases arising. The countries that have fared less well are the ones that have been slower in responding. And I really mean that speed matters here, because this is a very highly transmissible virus. And it means, therefore, that if you wait and are slow with your response, you will have very large, potentially explosive outbreaks. And once they occur, containing them is particularly difficult. It requires major restrictions on people's movements, what are sometimes called lockdowns, and these have major social and economic consequences. So rapid and early reaction, robust reactions, and making certain that at all times the people are fully involved in the response seem to be the hallmarks of effective action to contain COVID.
Okay. Well, our next question is about trust, which is a scarce commodity these days in international circles, but is essential for an effective global response to COVID-19. So the question is, what is the WHO doing to improve trust in its strategic engagements with countries?
Thank you very much indeed. The first element of trust relates to whether or not people themselves are trusted by the authorities to learn how to live with this virus as a constant threat, and then whether the people trust their authorities in giving them clear guidance as to what needs to be done. Unless there is trust among people and between people and authorities, getting on top of this virus in a way that enables life to go on becomes extremely challenging. That trust is fostered through transparency, making certain that people know what it is they're being asked to do and why, and also making sure that they know if there's a change, that the reason for this change is clear. Trust in turn can be undermined if there is inconsistency in the requests provided by national or local authorities, or if people themselves feel that there are different rules for some versus others. Maintaining trust within countries is key, but also trust between countries is important, because this is a global phenomenon. And I think there is a widespread concern among many, particularly those who have been used to dealing with outbreaks before, that between nations at the moment, there is quite a lot of distrust, and it's quite widely expressed, because in the absence of trust between nations, finding ways collectively to deal with the threats posed by this virus is particularly difficult. Two areas where trust has been particularly good and strong and seems to be growing is amongst scientists, because they are cooperating like never before, and also among business people who've realized that unless they can be operating together and comparing their own experiences, the prospects of them being able to re-establish viable operations is going to be very limited.
Great. So on that note, let's talk about vaccines. So what needs to be done now so that countries can coordinate and distribute a vaccine when one becomes available? And in particular, the students want to know, what is the WHO's strategy to help low-income countries gain early access?
Thanks very much indeed. The member states of the World Health Organization, the ones that meet in the World Health Assembly, actually came together earlier this month and agreed a resolution that requires the WHO Secretariat to do everything possible to support low-income countries and people within low-income countries so that they are better able to deal with their experience with COVID. It is abundantly clear that poor people, poor countries are being very badly affected by this virus. And that's why the WHO has constantly advocated for more attention to the needs of people in poor countries. One of the areas that's particularly important is the work to develop a vaccine that will protect people against COVID infections. There's quite a lot of work still to be done on understanding what kind of immunity develops after a person has COVID. Is it a durable immunity? And so that work is going on in many different locations. Secondly, there's work to be done to identify potential vaccines that can induce immunity even when a person hasn't had COVID. That work is underway as well, and a number of different approaches to developing a vaccine have been pursued. Not all viruses are easy candidates for becoming vaccines, and coronaviruses have always been thought to be particularly challenging. So nobody is saying that just because we have a potential vaccine candidate that necessarily it's going to be proven to be both safe and effective for widespread use. And that means that there has to be quite a lot of work done between having a candidate vaccine and then getting it licensed for use in different locations. It usually involves about 18 months of hard work with special kinds of trials that determine whether or not the vaccine does actually work. Those trials are now starting, and several candidate vaccines. Efforts are being made to speed them up. Though I think licensing authorities will be particularly careful. The last thing they want is to agree to a vaccine and then find that it has got side effects that in turn lead people to not want to take it. Let's say a vaccine has been found and has been tested, and we've got it available and ready to be licensed within the next 12 to 18 months. The next phase is making sure there's enough vaccine for everybody to be offered as many doses as they need to get immunity. When that's done, it's really important to ensure that it's not just wealthy nations that can get all the vaccine supplies that become available, and then poorer nations are left to fend for themselves, especially as in some cases the risks to their people are particularly high. That means there has to be a considerable amount of discussion between governments to establish protocols for vaccine administration. Some of the early work that's been initiated by the WHO, particularly a tool for accelerating COVID access to COVID-related tools, including vaccines, treatments, and diagnostics, has put a particular emphasis on ensuring equity. But nations need to really follow up on their commitments at the World Health Assembly earlier this month, and also what's happening through the accelerator that WHO is leading on, and not then go ahead and just organize their own supplies for their own people without paying attention to the needs of the world. That requires a very high level of effective diplomacy between nations. It is underway right now, but it will all depend on whether or not the different nations of the world are prepared to focus on this as a global issue and avoid just adopting a national approach to access to vaccines. WHO will advocate as strongly as possible for an equity-based approach in the forthcoming weeks and months.
That's a great point to bring me on to the next question. Now, there is an agreement about how countries are supposed to act in this circumstance, and it gives the WHO a leading role. What can the WHO do to improve compliance with this agreement?
Well, that is where the multilateral system actually does not always help us. You see, the way in which the whole of the multilateral system works is through a willingness of countries to trust each other and to work together, even in the absence of any kind of compulsion that might exist, perhaps if there was a greater form of enforcement in multilateral arrangements. The international health regulations exist. They're a legally binding mechanism in international law. It's soft law. But at the same time, if countries choose not to comply with the elements of the international health regulations, there is no capacity within the World Health Organization Secretariat to compel them to do so. And so therefore, what the WHO can do is to point out if countries are not participating. It has to do this extremely carefully, because you don't want to upset countries and make them even less likely to participate in a collective process. It cannot compel them. We all depend on the willingness of national leaders to work together for the sake of the people of the world. If they choose not to do so, we can plead, we can continue to encourage, we can even occasionally point out that certain nations are just not doing what other nations are doing, but we have to be extremely careful not to call them out, and we have no capacity to compel them.
We have a question about whether the WHO is best positioned to be leading the crisis, given that its mission puts all the emphasis on health rather than development. What do you think about that?
I saw that question and I thought hard about it, because in reality, this is much more than a health crisis. It's a cascading series of crises that are leading to unemployment and impoverishment, to real challenges in food systems and in nutrition, and also difficulties in a number of sectors, including travel and tourism, on which many, many people depend. It's going to lead to real difficulties in continuing progress towards the Sustainable Development Agenda, which was agreed by world nations in 2015. And so one of the things that's evolved is a real effort by the United Nations Secretary General to make sure that the whole of the United Nations system is coming together in support of actions in relation to this crisis. The World Health Organization is an important part of this system, along with many other United Nations entities, together with the International Monetary Fund, the World Bank, and other similar institutions. In this, therefore, WHO is the technical lead agency, but we see that the wider UN system, under the stewardship of the United Nations Secretary General, is very much leading on some of the non-health aspects. They're doing it together. There is an extraordinarily well-established and properly functioning coordination system that goes right across the UN, with weekly engagement and so on. And I would say that that means that there is a total system response to this, with WHO as technical lead, but with a strong role being played by the Secretary General of the UN, Mr. Antonio Guterres.
So, what is the worst case scenario that we are facing now, as the first part of this question? And given what we have seen from responses to date, how far off that scenario do you think the world will end up, as the second part?
I want to stress that this COVID causes outbreaks that start small and build up large, but they are very tightly located spatially. You get a cluster of cases in a particular location, causes major problems in that location, but 100 kilometers away, there may be no COVID at all. It doesn't sweep through populations like certain other diseases do. Very focal. Not only that, there will continue to be focal outbreaks of COVID for the foreseeable future. As at this time, with many people in the world experiencing some form of lockdown, there's been a slowing of the spread of the disease, and outbreaks are pretty much located where they started. There's been relatively little spread because people just haven't been moving. But as soon as movement restarts within countries and between countries, there will be a lot more outbreaks. That's inevitable. And so the best case scenario, which is what I want to start with, is that everybody everywhere understands the role that they can play in interrupting transmission of the virus, and does all they can through changes in their personal behavior to reduce the risk that new outbreaks start up. Or if they do start up, that authorities have the public health capacity in place to be able to contain them quickly. But supposing the capacity to contain is not there, supposing people remain confused and do not understand the roles that they personally must play in order to reduce outbreak spread, then we're going to continue to see outbreaks building up, sometimes very large outbreaks that perhaps are missed because people just don't understand what they've got to do. This is particularly the case in countries that had quite a number of outbreaks some weeks ago, then imposed lockdowns, but have started to release their lockdowns without putting the public health defenses in place throughout their countries. They are particularly susceptible. Others that have put the public health defenses in place, like South Korea, were ready for possible returns of COVID outbreaks that might occur, and were able quickly to act to close them down. Same as the case for Singapore. which has had major outbreaks in some of their foreign worker dormitories, and they've taken action to close those down. Or Germany, which had very good defences in place, but has also got new outbreaks happening and is dealing with them. So a well-organised country has the capacity to identify and rapidly contain and then suppress outbreaks, maintaining societal and economic activities as much as possible. The countries that don't have that capacity in place or underestimate the importance of COVID and are saying, we're just going to get on with life, regardless of whether or not there are further outbreaks, they're the ones that are in particular danger. Some of those countries are quite advanced countries, and they're countries that are connected to the rest of the world. If they've got continuing COVID outbreaks and they're still maintaining economic activity, then they're going to seed the virus into other parts of the world and not only be a threat to their own people, but they're also going to be a challenge to elsewhere. This is a particularly important issue and one that I don't think necessarily is fully understood, even by the leaders of the countries who are saying that as far as they're concerned, COVID is not a serious problem.
Well, let's pick up on that because we have a question about drawing long-term lessons, I think, in these less successful examples. So should there be government inquiries? And if so, when should such processes start, given that the pandemic is very much unfolding and evidence is still coming in?
Thank you. I actually think we need two kinds of activity in relation to this pandemic. First of all, because it is still unfolding and because we don't know what's going to happen as more and more COVID outbreaks occur in many different regions across the world, it's necessary to be constantly learning where the virus is and how it behaves, learning the best possible responses. For example, what aspects of economic activity must be maintained and what aspects can be restricted so as to perhaps reduce the likelihood of spread, particularly when there's a lot of virus about. We also need to learn how to protect people in particularly vulnerable situations, older people in residential accommodation, people working in very crowded factory or market conditions where spread is likely, or people who are at particular risk, like security guards or bus drivers or others who seem to be susceptible. That kind of learning has to go on all the time and should go on and should be part of how we work. It's why we need a unified overall approach to the response, why we need a World Health Organization and other institutions that provide space for learning. That's the good thing. But there's another tendency that's emerging, which is the requirement by certain nations for there to be inquiries held, inquiries that could take up the time of people, for example, in the World Health Organization, who are working extremely hard at the moment just to try to help nations deal with the problems they face. If you institute a detailed inquiry right when you're in the middle of the operation, it really is taking people away from the jobs that they should be doing. I'm saying there should be inquiries about how the whole world has dealt with this pandemic, not just one part, the World Health Organization, but by how local authorities, national governments, different sectors in the economy, how they all dealt with it. But that inquiry really should take place when we can look at each other and say, okay, we've got through the worst of it. We think we know what's happening. Now we can actually stop for a bit and take a breath and do a detailed forensic inquiry, which calls everybody to account, not just the international organizations, but also national governments. That's when all of us should be called to account. That's how it should be. And I think that's how it will be. But I would plead with everybody concerned not to do it when we're right in the middle of fighting the fire. It just seems inappropriate.
And that leads us on to the last question. And that is really about a context of seeing increasingly nationalist agendas from countries. And I wonder whether what you were saying there about a process of accountability could encourage a spirit of global cooperation in the future after this pandemic. Do you see that happening? And if so, how?
There will have to be global cooperation. There will have to be a unified strategic approach dealing with COVID. And it will have to come in due course, because otherwise it's going to be really hard to reopen international travel and trade. It's going to be really hard to get tourism coming up again, which is so essential for poor countries, and businesses are going to continue to struggle. Many more will go bankrupt. It's just, I wish that this unity of purpose between nations, as well as within nations, could happen now, rather than having to wait more and more months for it. Because this is a compounding problem that gets much, much more difficult to deal with the longer we wait before we have a unified and properly coordinated response. So it will come. It will come because people will plead for it, because they'll see just how much suffering there is. They'll see what an extraordinary and deep crisis we're going to have all over the world. And we can see the early signs of it now. I've worked on enough crises in my 45 years in international work to know that this is going to become really serious for so many people in so many nations, more serious than it is now. And it's going to go on affecting even the advanced nations that are releasing their lockdowns, especially if they haven't got proper public health defenses in place. It'll continue to be a global crisis for weeks and months to come. And so not only, I think, will people realize and leaders realize that we must have unity and they will need to change positions, but also we will realize through this that unity is necessary for more than just dealing with a massive health crisis. It's also necessary for dealing with the grinding inequities in our world that indeed create so much susceptibility to a challenge like COVID. It's also necessary to deal with the destruction of nature and the loss of biodiversity. And it's absolutely essential to deal with climate change. We'll come through this much stronger as humanity. We'll learn that by working together, we can deal with these existential threats. It's just, I wish that the learning and the realization could happen just more quickly, because the longer we delay, the more suffering there will be, and the bigger the challenge we face in trying to get on top of it. We'll have to have stronger public health services. We'll have to have new ways of caring for older people in residential accommodation. We'll have to look at the employment conditions of people who find it so hard to practice physical distancing and avoid COVID, for example, in meat processing plants. We'll have to re-examine the conditions under which people live in slums, which currently are proving to be really tough when it comes to dealing with COVID, particularly in poorer countries. The quicker we get focused on that, the better, because otherwise the human toll will be just astronomical. This COVID will go on causing misery and suffering. It won't just suddenly disappear.
Well, I think ending on a to-do list for future public leaders is a great way to wrap this up. Dr. David Nabarro, thank you very much indeed.
Thank you. Thank you very much.